Hello, this is Dr. Marcelo Kugelmas. On behalf of the Chronic Liver Disease Foundation, I'd like to thank Madrigal Pharmaceuticals for their support in bringing you this educational content.
Hello and welcome. I'm Dr. Kimberly Brown. I'm the Associate Medical Director for Liver Transplantation at Henry Ford Hospital. And one of the questions that I'm always asked is how best to predict progression in a patient who has MASLD or MASH. We recognize that probably about 20% of patients who are first defined as MASLD will progress to the inflammatory component or MASH. And it's estimated about 20% of those individuals will progress from MASH to cirrhosis over time. And there have been many estimates around what the rate of progression is. It's estimated that perhaps 17 years to progress from MASLD to the inflammatory component and fibrosis with MASH, and perhaps a shorter time, 7 years, to progress in a patient who has existing inflammation and fibrosis or MASH. But we also recognize that there are patients who progress more slowly than that and more quickly than that. And there's been a lot of discussion around how to identify the patient who may progress at a faster rate. When you look at the AASLD guidelines, it's recommended that in a patient with MASLD, in the absence of diabetes, that perhaps repeat fibrosis assessment be done in 2 to 3 years. But in the patient with type 2 diabetes, perhaps that should be shortened. We recognize that 2/3 of the patients with type 2 diabetes in the United States likely have MASLD. So to shorten it in a patient who has existing additional metabolic risk factors, we do recognize that the more metabolic risk factors you have, the more likely you are to have fibrosis. But it is very difficult to tease out anything aside from age as to having the ability really to identify the fast progressor. Genetics likely play an important role as well, both in terms of developing MASH, but also in terms of the rate of fibrosis progression. And then other factors, possibly including the presence of type 2 diabetes, poor control of glucose, poor control of lipids, but additional factors such as alcohol consumption. We recognize that alcohol has a similar histologic pattern to MASLD and MASH. And in patients who take additional alcohol, they would have additional risk of injury. And when you look at the AASLD guidelines now, these individuals are categorized more as MetALD, dependent on the degree of alcohol that they consume. So there are a number of factors that will at least identify the patient likely at risk of more rapid progression to higher stages of fibrosis. Again, the older the patient is, the degree of fibrosis they have to begin with, possibly the presence or absence of type 2 diabetes, but certainly additional metabolic risk factors, alcohol consumption, and then obviously likely genetics, family history. So unfortunately, we don't have the magic key to identify who will progress more quickly or less quickly. But I think in those individuals with the risk factors that I've just identified, frequent fibrosis assessment every 1 to 2 years, I think is critically important to identify that patient who may be progressing or may have progressed to the point where therapies are approved and warranted. So thank you for listening today. If you need additional information, please visit the GAP website. Thank you.